international, we know that there is a very much importance of this research in our nursing education. So, as a need of current need of for our students in the nursing education, the Samarpan Institute of Nursing Paramedical Sciences decided to have this webinar series, and we are lucky to have the eminent speakers from all over the country. Selected topics we have taken. This webinar is going to be run for the 7 days, and today is the first topic, that is introduction of nursing research, importance in utilization in modern nursing. Today we have with us our chief guest, Dr. Alka Saxena Madam. She is the principal, Government College of Nursing, Gorakhpur. Madam, I welcome you on behalf of Samarpan Institute. We do have our guest of honor, Dr. V.P. Tiwari sir. He is our director of Samarpan Group. Sir, I welcome you for this webinar series. And I do welcome today's speaker, Dr. RANJANA SHARMA, Principal, Officiating SMC1, Fellows, Wardha MS. My special welcome to our patron, our father, our guide, to this special guest, Professor Dr. R.S. Dubey sir, for being with us in this hall for such a wonderful program, a series that is on research, and sir is also a professor and a biophysician, he's a doctor. So, sir, I welcome you for this webinar series. I do welcome all the respected principal, faculty, students from different colleges who have joined us for this webinar series. Thank you so much for being with us, and I wish that you all will be here for the next 6 days. I straightened off my voice on this point, and I'm handing over to Mr. Nanda for the further program. Thank you so much. I welcome all of you again for this webinar series. Yes, Sunil, you can. Dr. Alka Saxena ma'am, who brings an exceptional wealth of experience and knowledge to the stage. 8 years of professional experience, including 23 years after completing her postgraduate study and following her PhD. Dr. Saxena ma'am has dedicated her career to the field of nursing and healthcare administration. She has served as a principal and professor at various prestigious institutions, including the BRD Medical College of Gorakhpur, UP, and Sophia Nursing College in Gwalior. Ma'am, education background is equally impressive with a master degree in nursing, the specialty is medical surgical. Throughout her career, ma'am has exhibited a diverse skill set, including the general administration, supervision of students' welfare, guidance of teaching staff, and contribution to nursing education and research. Ma'am has also been an active participant in numerous workshops, seminars, conference, and webinar, speaker, and a moderator, showcasing her commitment to professional development and knowledge dissemination. Furthermore, her significant contribution to the nursing field are reflected in her role, examiner, paper setter, board member for various universities and organizations, contributing to the standardization of the nursing education and evaluation. We welcome you, ma'am. I request you, please speak some few words for the session. Thank you.
Thank you so much. Thank you, Deepti Madam, for giving me this opportunity to join this webinar series, which we have planned as the national webinar series. And I hope that all the people you have they are very on, speak on, and the student get an idea about what is the research and how they will apply this knowledge after getting all the lectures. So how they can utilize this knowledge in the field of nursing and how to take care of the healthy person, non-healthy, as water will helpful for the patient care, education, and in nursing management. So I think the students will get benefited. Thank you so much once again. Thank you.
Thank you, ma'am. Now I want to introduce our guest of honor, Dr. V.P. Tiwari, sir. He's a director and ex-director of Himalayan Forest Research Institute. Over 30 years of working and leadership expertise under environment, forest, and climate change at the Government of India. Sir is the author of 8 books and 112 research papers. I request sir, please kindly speak few words for the session.
Thank you, madam. Respected Chief Guest, Madam Saxena, Chairman of the Samarpan, Professor Dubey Sahab, Dr. Sharma Madam, Principal Assigned PS, and all the faculty and the students who are joining this ceremony. As has already been told by Principal Assigned PS, that we have started a national webinar series, and this series will go for 1 week from 16th to 21st of this month. And the topic is very appropriate and very crucial. Evidence-based research in nursing. To me, research is always evidence-based. Without evidence, no research can be done. But there are many types of researches have been done, so that's why deliberately this word has been prefixed as a evidence-based. But whosoever is researcher, that researcher knows that if you are going to do a research, you have to create some evidence. And we are doing a lot of seminars, conferences, webinars in the nursing. But SIPS and Principal and her team had deliberately chosen this topic, that research in nursing. Because if you want to do any invention, any innovation, research is always there. Without research, you cannot do any invention, you cannot do any innovation. And whenever you need to have some development, you want to have development in the society, development in the infrastructure, development in the scientific equipment, development in the nursing field, or any other scientific field. Research is very much required. And then how to do that research, how to get the problem, how to select the problem, what should be problem statement, how to frame the research topic, research area, what should be your data collection strategy, what should be appropriate methodology, and whenever you have collected data, then how to analyze and how to interpret those data. And to formulate any research project or to write any research paper, you need to go for the thorough literature review. So how to do that literature review? There are many things which are interwoven, and I have seen that in this webinar series, all the 5 days there are different speakers from eminent organizations, and they have lot of experience, and they will deliberate, they will speak on the various aspects of the research, and particularly the application of that research in the nursing. And I hope that this webinar series will be extremely beneficial for our younger students and the new faculties who are recently joining the nursing in various institutes in various states. So, and if they want to excel in their career, they want to do something, they want to excel in the research and want to contribute to the society with their innovation, with the invention, this type of webinars will be very, very beneficial, very extremely helpful to them. And I wish all the success for this webinar. Thank you very much.
Thank you, sir. Now I want to introduce our patron, our special guest, founder, chairman of the Samarpan Group, who always guide us in each and every step. Professor Dr. R.S. Dubey. Sir is the ex-director of TSM Medical College and Hospital, member of UP and Hospital. Sir is a member of UP State Medical Council. Sir is the ex-director and CMS RMN Hospital in Lucknow. I request sir kindly illuminate some wise words to our audience.
Thank you very much for saying few words. As you all know that Software Nursing and Computer Sciences Lucknow is organizing a series of webinars from 16th to 21st under Mission Jaramaya, that evidence-based search application in modern nursing. Enough has been said by Principal Dr. Shukla, Dr. Tiwari, Director of the Institute. Nothing more to say, except I would like to emphasize that Research is a very important aspect of teaching and learning. In present era, without this, it is not possible to face with modern medicine and in modern era. I thank you all, especially my principal and Tiwari and those speakers who are participating in last coming 5-6 days on different topics. I must congratulate them once again, and I wish and I thank for a great success. Thank you very much.
Thank you, sir. So now we are moving toward the session, our first day of this session. The topic is Introduction of Nursing Research, Importance and Utilization in Modern Nursing. I want to introduce our key speaker, Dr. RANJANA Sharma, ma'am. Ma'am is currently working as a officiating principal of SNCON, Talor, Hirapur, Wardha. I just want to give some brief introduction of ma'am. So ma'am is currently working as a principal officiating. Salinitrai Make College of Nursing, Salon, Hirapur. Ma'am completed her BSc degree from Mother Teresa College of Nursing, Kumhari, in the year of 2006. Ma'am has a master's degree in medical surgical nursing from SRM College of Nursing, Savangi, Wardha, in the year of 2010. Ma'am is MPhil GNMC DMMIS DU 2014, was a fellowship at SOAS DMIMS 2016. Ma'am is a bioethics and law, medicine and the ethics of reproductive technology and genetics, Harvard University, in the year of 2020. With an impressive academic journey marked by the proprietary achievement, MAM has left an indelible mark in the realm of nursing education and healthcare. MAM has authored an impressive array of 125 publications, surpassing her dedication to advancing nursing knowledge. Her commitment extends to sharing insights through 30 poster presentations and 9 paper presentations, making her a stalwart in disseminating valuable information within the nursing community. As a seasoned resource person and speaker, MAM has actively participated in 40 events, contributing her expertise to enrich the learning experiences of her peers, holding the position of chairperson in 10 instances to reflect her leadership, acumen, and influence in various academic settings. Her prowess extends beyond her national border, with recognition from the Maharashtra Nursing College as a distinguished speaker and observer. MAM's contribution to education is further underscored by being a three-time recipient of the Best Teacher Award from SRMM CON, DMMISU. MAM stands as a recognized postgraduate teacher and has made significant contribution as the head of Department for Medical Surgical Nursing at SRM CON. MAM has authored textbook for anatomy and physiology for undergraduate. MAM has actively contributed to the academic community by supervising PhD candidates, serving as the treasurer of the Alumni Association of SRMM CON. MAM has served as the secretary for CDP at the Maharashtra Nursing Council. MAM has also served as vice chief examination on DMIGR and convener of the nursing education at SRMM CON. We are blessed to have such a great visionist among us today. So we welcome you, ma'am. Good afternoon, everyone. इधर का वीडियो आपको ठीक है सर, हम लोग मूव कर सकते हैं सेशन में दोबारा जरूर Yes, ma'am. Yes, ma'am. So, you will not take us later. Okay, so we will start with this and thank you so much, respected Dipti Shukla Madam, Tiwari sir, and today's chief guest, Alka Saxena Madam, and my dear student, very good afternoon to all. So on the basis of this learning objectives, I am going to present the first topic of this webinar series. We will see about what is nursing research, and we will see the importance of nursing research and utilization in the modern nursing. So first of all, us we will see what is this nursing research. So nursing research in perspective, it is exciting and challenging time to be a nurse. Yes, of course. When we are getting in and it is a very exciting how we are going to become and it is very challenging during our period of doing our courses and time to be a nurse. And not only this, nurses are managing their clinical responsibility at the time when the nursing profession and the larger healthcare system require extraordinary range of skill and talent of them. The best example is during the COVID-19, we all nurses, especially the nurses, they have given their extraordinary skills and they have shown their and they have proved their talent. Then nurses are expected to deliver a highest possible quality of care in a compassionate manner and also being mindful of cost. Yes, that also we are applying. How with the minimum resources we can provide care, quality care to our client. That only the nurses can do that, I can say. Then, in today's world, nurses must become lifelong learner. Yes, we are learning. We thought when we have completed our graduation, we will not go for the higher education. Then again, we some technical glitch. I think a screen share screen is not moving now. So in today's world, nurses must become lifelong learner. Yes, and that's what today we are going to learn about the research. Otherwise, we can wind up during our graduation and the post graduation and all. But it is that much is not enough for the present society and the present scenario. Yes, and capable of reflecting on what we are doing. That reflections are supposed to come from us, then evaluating and modifying their clinical practice based on new knowledge. Yes, we are also applying our new knowledge in our clinical practice. Other than that, nurses are basically expected to become producer of new knowledge through nursing research. Yes, today see so many nurses and how that we can having the example in front of us. Okay. Then we will see what is nursing. Research is a systematic inquiry that uses discipline, method to answer question or solve problem. Those who have studied nursing research, they know about its definition, that they are just for the advising purpose. The ultimate goal of research is to develop, refine, and expand our body of knowledge. Yes, and nurses are increasingly disciplined study, and that will be benefited the profession and HDMI से डबल डबल वॉइस ले रहा है टीवी की आवाज और इसकी भी आवाज लेकिन सीधी पे जा रही है इसलिए कंप्यूटर में खुद की आवाज है ना knowledge अर्पण that अर्पण इसके सामने से बार बार यूट्यूब लाइव चल रहा है वही सर सबको बोला Then, nursing research is a systematic inquiry, as I previously said, designed to develop knowledge. Practice, it includes the education, it includes the administration and the informatics. Yes, nursing practice that since many days we are doing, but that in the education also now we are going to apply. Make that competency based learning syllabus or semester was also involved and informatics in this meeting. Then clinical nursing research. Yes, we can do the clinical nursing research also and research to generate the knowledge and provide the nursing practice and to improve the health and quality of nurses clients. मेरे को लगता है किसी बच्चे का 4 वर्ष क्लास में Nurses are increasingly to understand and undertake the search and to base their practice from different studies are the new things we are applying for our clinical areas, like for example, I will take in the education, I will give the example of one education, like simulation. Simulation. Before we are learning the things in the lab and going in the clinical for the practice. But there will be a standardized patients will be there, and we can learn the standardized patients, the dummies, the many skills, and very nicely we can apply this knowledge. Our students can apply this knowledge in the clinical without any fear. When nurses are accepting the need to base scientific nursing action and decision on evidence indicating that the actions are clinically appropriate, should be to whom we are applying, for what purpose we are doing, that should be clinically appropriate. It should be feasible, it means cost effective, and the result in the positive outcome of the clients. You might have heard, or most of the time you are hearing from your teachers, do the research on the basis should benefit to the client, it should benefit to the patients, not simply for the namesake. Many times when the title section is there, so what is the benefit for your patient? The teachers will ask, and we are supposed to focus on that. Then, nurses who incorporate high quality research evidence into their clinical decisions and advice are being professionally accountable to their clients. What we are doing is really accountable for our clients. And they are also reinforcing the identity of nursing as a profession. And we have to reinforce our identity as we are a nurse and nursing as a profession. Then another reason for the nurses to involve in a research, to engage in and use research involves the spiraling cost of health care. Means it should give the strength in the care and the cost containment practices being instituted in the healthcare facilities. Okay? Then now more than ever, nurses need social relevance and effectiveness of their practice, not only to the profession, but also, but yes, to nursing care consumers, those who are taking care or those who are giving, providing the equipment center and the healthcare administrator and third party payers like insurance companies and the government as well. Yes. Then some research finding will help eliminate nursing actions that do not achieve desired outcome, but they are also the research. It failed, it doesn't mean that we should not do the research. If we are failing, every time you will not get the positive results. Okay. Then other findings will help nurses identify practice that improve the healthcare outcomes and cost as well. Like you might have heard, if some students are there, UG students who did not have identity kangaroo mother care, is a all cost benefit. If the newborn baby is there and low birth weight baby is there and giving the kangaroo mother care in the cell, it will stay touch from the father or the mother, it will improve the weight of the particular child. So this is the one evidence. See here. Then research enables nurses to describe the characteristic of a particular nursing situation about which legal is known. So to explain phenomena that must be considered in planning nursing care means when we are taking the history of the patient, that time we are taking their cultural background, their family history and all. Why? We want to know the phenomena of particular client with their cultural background and with their family histories. And it will help for our research also. It can correlate with the subdisease condition, it can correlate with the environmental backgrounds and all. It will come to know without sharing the history of particular things, we will come to know the person is having this kind of problem and it is from the one generation to the another generation. Or during the care also we have to take care of the background, financial background and to predict the probable outcome certain nursing decision. That only it will correlate with taking our decision. And it will also control the occurrence of undesired outcome and to initiate the activities to promote desired client behavior. Then initiate our activities and then promote the which kind of the behavior for that particular client we can require that will be promoted. Okay. Then the consumer producer continuum in nursing research. This is very important. If we bring the evidence based, how it will be the evidence based. Now, with the current emphasis on the evidence based practice, it has become every nurse's responsibility to engage in one or more roles. Yes, we are participating directly, or those who are not participating directly, definitely they are participating indirectly. I will tell you how they are participating directly. At one end, the continuum are those nurses whose involvement in research is indirect. Okay? Consumer of nursing research read research report to develop new skills and to keep up to date on relevant findings that may be after their practice. Yes. Means nowadays our consumers are also very educated and they are also knowing about some of the things and they will ask you, madam, why not this sense, why not that sense? So you also have to be good for practicing that particular type of the thing. Then nurses increasingly are expected to maintain this level of involvement with research at a minimum. I have to suppose today I am taking the topic related to the research. So till where it has reached the research, till where it has reached and how it is necessary for this new modern research that I suppose to read. Then research reflection. The use of research finding in practice setting depends on intelligent consumers. Okay? Then at the other end of the continuum are the producers of nurses. So who is that? Nurses who actively participate in designing and implementing research studies. They are the producers and those who are using this, they are consumers. Okay. At one time, most nurse researchers were academics who taught in school of nursing, but research is being conducted by participating nurses who want to find what works best for patient. We all study, we know about the research, but the very few we are doing and we are searching which one is more benefited for our patients. Okay. Then between these two endpoints, each one, each variety of research which nurses engage a way of improving their effectiveness and enhancing their professional lives. We are reading and we are doing and we are applying so we can improve our professional lives. Then this activity includes the following. How this can be refined or what are the things we have to improve the things. So participating in the club in a practice setting which involve regular meeting among nurses to discuss and prepare the such matters. Our MSc students
doing the journal club and India, we critic on a particular research article because one research cannot 100% fulfill all the criteria, and afterwards you cannot again you cannot do that kind of service. It's not like there we need find out where is a positive and where is a negative thing and how you can generalize for the next we can do on that particular topic again research. Okay. Attending research presentation at professional conferences like this is also one kind of the professional conference, and I will come to know from the starting to the analysis and the data collection and all, and how to produce the result, how to write the abstracts and all. Okay. So this is also one way to improve our knowledge and discussing the implication and relevance of research finding with clients, yes, and giving clients information and advice about the participation in research. Okay. Then, assisting in collection of research information, we have to involve ourselves in all the steps. If we will think only study, only reading is enough, no. To know the research from the depth and to the practice, we have to involve ourselves in the particular activities. So, distributing the questionnaire to the patient and reviewing the post-research plan with respect disciplining in clinical setting and offering clinical expertise in the lab. Okay, we have to give our opinion also, and we have to review the proposal research plan. Okay. Yes, you know that before proceeding the research, you have to take the ethical clearance from your institute. So that comes that. So they will see whether it is feasible or not, whether it is feasible in clinical setting or not, cost wise, and whether outcome will give any good result for the patients or for the student or not. Then all things they will see in the institutional community. Then collaborating in the development of an idea for clinical research project. Also, in the collaboration of the idea in the clinical research projects. Then participating on an institutional committee that review the ethical aspects of the proposed research before it is undertaken, as already I explained to you before going to proceed for a particular research should be in front of the institutional committee that is ethically required, then evaluating the complete research products. Use, practice, and using the way it is effective. Then, in all these activities, what above we have seen, nurses with some research skills are in a better position than those without them to make a contribution to see knowledge. Some are having more interest and they will show their research skill in better, and some will contribute see knowledge. And understanding of the nursing research can improve the depth and breadth of every nursing professional practice. Definitely, if we are understanding and we are using and if we are applying for our patient, so it will increase our professional practice. Okay, so we will see now the future directions in nursing research. That was a theoretical part, and at a glance, I will tell you how it is very important to know about nursing research. So, technology advancement, you know very well. Now, the new technologies are there, cultural diversity and the global collaboration, and addressing the complex healthcare challenges. So, first, we will see about the technological advancement. Discover how nursing research addresses technology advancement such as artificial intelligence. Not only doctors are involved in this, not like that, the nurses also involved, and you have heard about the telehealth, telemedicine, that also came out from the research only and to recognize healthcare delivery and improve the patient outcome. So if the patient is far away from here or some artificial intelligence are useful to the patient's outcome. Okay, at last, some people from the participants, please tell me the example of the telehealth and the artificial intelligence where we are present. Okay, in the last. Then cultural diversity and the global collaboration. Explore the future of nursing research, emphasizing the importance of cultural diversity, global collaboration, and the integration of the multiple perspective for the companies of healthcare and the advancement. We have to do the global collaboration to know their views and that views are it is benefited for the healthcare so that also okay. Then addressing complex healthcare challenges, uncover how nursing research leads the way in developing an innovative solution to complex healthcare challenges, ensuring the delivery of patient centered, effective, and the sustainable care. Sustainable care. Now we will move to the some little bit more detailed utilization of see research, evidence-based guideline, see education, and the policy development. With the present the utilization of the nursing research. Okay, evidence-based guideline. Learn how nursing research findings inform the development of evidence-based guidelines that guide nursing intervention and patient care outcome. I will give one example like preparing the new protocols according to that protocols you are giving care to the patient and you can use the patient care outcomes and this is generated by the nurses from the nursing faculty only and with their experience their researches that interventions and that help for the patient and the good outcome for the patients. In nursing education, discover how nursing backbone of nursing education, keeping inspiring and current nurses with the knowledge that is needed for this practice. Our senior people are there and they came to know what is the current scenario, what is required for the present society. According to that, they have developed made the changes in the syllabus as well in the clinical parts and all knowledge is required. Then policy development, yes, uncover how proceeds local, national, level, and shaping the healthcare landscape and promoting the human patient care. Okay. Then some more elaboration in research utilization. The emphasis is translating the new knowledge and into the real world application. And evidence-based practice is a broader concept than research utilization because it integrates research findings with the other factors as just we have seen before. Then knowledge translation, research utilization, and evidence-based practice involve activities can be undertaken at the level of individual nurses or at the higher organizational level. It can be individual based or maybe in the administrator, the administration based for the application of that knowledge, new knowledge, clinical setting or maybe the institutional setting. Then we can see the World Health Organization has defined knowledge transformation as the synthesis, exchange, and application of knowledge given to different stakeholders to accelerate the benefit of global and local innovation in strengthening health systems. the people's health. We will see World Health Organization, there are many guidelines and many things the people are uploading and that we can utilize for our patient according to our need of the patient. There will be many things are there. Many scales are there, guidelines are there, protocols are there for the different disease conditions. Then evidence-based practice in nursing. Before describing procedure related to the evidence-based nursing, we briefly discuss the important issues, including the nature of evidence, challenges of pursuing evidence-based practice, and resources available to address some of those challenges. See, so we are taking evidence-based nursing practice, evidence-based nursing practice. Before that we have to see which nature of that evidence, whether that evidence is applicable for my setting or not, my patient or not, and what are the challenges can occur when I am going to apply this particular research, evidence-based research for my patient. That we have to see the resources are having that also have to address, and then only we have so, evidence-based clinical decision can be taken by nurses with the best available research evidence and nurses who are clinical expertise and need and preference for the patient. So, this is the main thing when you are going to apply any evidence-based nursing research or the practice. You see best available research evidences, your own clinical decision and need and preferences of the patient, whether it is required for my patient or not. Then, when we are preparing synapses, for example, I tell you, you have to go for the PO format. Here, P also can come. Okay. So, like for example, this phenomena or ibuprofen more effective at reducing fever in children? Question mark. Whether it is a question. So, just see who is your population, what is the problem, or who is your patient. So, you find out the children. Okay. From there, only patient or population of problem supposed to come here. Then intervention. What intervention you are going to give? Then, is there any control or comparison or any doubt control? So, to whom you are going to give? Then, what will be the what will be the outcome? What will be the so that when you are preparing your statement, we go for we go see population or see what intervention, how you are going to compare or only you are going to pick single or outcome. What will be your outcome? Which you can assuming. Then type of evidence and its practice. Okay, so there is no consensus about what constitutes usable evidence for the evidence-based practice, but there is a general agreement that findings from the rigorous research are paramount, and yet there is some debate about what constitutes rigorous research and what qualifies as based on evidence. We will see there is one pyramid, yes. So previously, starting from the base quality of evidence, how it is starting. So expert opinion. The base expert opinion that also can be published, and that expert opinion is given by the scientific, that is a scientific views or those who are designated for a particular as an expert like role of nurse in COVID-19 or how the in COVID-19 nurses had given the care. So that opinion can be published and given and that can be read and utilized for the patient. Like a single descriptive or the qualitative study. Qualitative study means for a focus group you will ask their views. For example, I will tell you chemotherapy. So when the patient is taking the chemotherapy, that time what the patient is feeling,
Feelings is comes under the qualitative study. They include different kinds of I am feeling nausea, vomiting, I am having pain, I am feeling sad. So this comes under the descriptive of the qualitative study. Okay, there is no intervention. You are not giving the any intervention. Just you are taking as the interview or a demo. Okay, when the systematic review of descriptive and qualitative study. Okay, again, so only survey kind of the systematic review for the both qualitative and the quantitative. So here for a particular point, you will search different opinion and then that you will compile that opinions and will publish the research that is for the systematic review. And when you are going for the quantitative, so definitely again then control trial, no randomization. That says there is a no there will be a experimental group, but there is no control group. Like for example, cohort study in the sense people suffering with the chronic renal failure or tuberculosis. So that patients you have taken and you are identifying what was the risk factors for the chronic renal failure. You are not taking suppose 50 patients you have taken, for that 50 patients only you are doing your study in a particular point. You are not involved in the 51 or 50 certain time. Today, from a particular area you are taking study. Okay, then this is a very pure study again, randomized control trial. Any nursing faculty or nurses are saying we cannot do definitely we can do this control trials and there will be a experimental group, control group and randomization will be there and you have to register your CTI the God is provided what you are doing, how you are doing. Okay. So you will learn that people are going to take themselves designs and all that. You will learn that's all in the clinical guidelines. The clinical guidelines are like ICMR guidelines for the vaccination. AIDS from the AIDS some guidelines produced for the nurses how to take care of the diabetes hypertensive patient. CPR is one of clinical guideline how to proceed for the CPR for children, how one is here, how to provide to this during how to provide. So this all comes under the clinical guideline. In the systematic review, it's a very high level of the view. As I said, here systematic review for the qualitative study. Here both can be qualitative. It means particular topic, revealing the 10, 20, how much you are reading. You have to read the thousands or more than thousands study and from there the particular topic as to want to know the risk factors of the chronic renal failure patient. So from that 1,000 or 2,000 failure, what study has done and what results produced. So we will move to the right. What is that? The power of nursing research. So the power of nursing research, evidence-based practice, patient outcome, and advance in the nursing profession. Okay. So first one, explore how nursing research plays a crucial role in shaping the evidence-based practice, allowing nurses to deliver the highest quality care based on this scientific findings. Okay, yes, and we are doing things. This is also one kind of the nursing, tele education. Okay, then this is the one example. Improving the patient outcomes, discover how nursing research applies evidence intervention and interventions leading
to improve patient outcome and care quality. This comes under the patient outcomes. Third one is advancing speed is to learn how to fosters emotion drives our patient elevates the concentration as it's this the power of nursing research. Other than that, see, the references are I will refer the book Polytech Hamlet, and other than that, in the modern nursing, the patents. Have you heard about the patents? Patents in the sense some devices. Devices you are using for the patient care or the research, so that now our nurses are developing, and your duties you have also developed and patents. So that also comes under the modern nursing research. It's all about present. If anybody is having any questions, they can ask.
On behalf of the Institute of Nursing and Medical Sciences, I would like to thank Dr. RANJANA Sharma for his beautiful and knowledgeable session on the topic of introduction of nursing research, importance and utilization of modern nursing. Thank you so much, ma'am. And we are blessed that you are today with us. So we will be continuing our this chain of the sessions. Tomorrow we'll be having the same session at the same time. Thank you so much.